Health insurance executives are going into hiding following the murder of United Healthcare CEO Brian Thompson. Wednesday morning, an assassin using bullets with the words deny, defend, and depose fatally shot the man responsible for making United Healthcare one of the wealthiest insurance companies with the highest rate of denials for healthcare. According to 404 Media, United Healthcare removed a page from its website listing the rest of its executive leadership, and several other health insurance companies have done the same, hiding the names and photos of their executives from easy public access. As of Thursday, United Healthcare's About Us page that listed leadership, including slain CEO Brian Thompson, redirects to the company's homepage. An archive of the page shows that it was still up as of Wednesday morning, but is redirecting at the time of writing. It isn't directly accessible from Google search or the site's navigation buttons. It's not just United Healthcare that is hiding its executives. Anthem Blue Cross Blue Shield, which Thursday said it would walk back changes announced this week that would charge patients for anesthesia during procedures that went longer than estimated. So it's an arbitrary amount of time. Now redirects to its own leadership page, to its About Us page. Yes, so it goes from leadership to About Us, which has nothing, no information about who us is. So, great. Originally, that page showed leadership, including President and CEO Kim Keck, Executive Vice President and CFO Christina Fisher, and 23 more executives as of earlier this year, according to archives of the page, but is now completely inaccessible. Gaslighter on X spotted other major insurers following suit. In fact, nonprofit health insurance organization CareSource took down the individual pages for all of its executive leadership, including President and CEO Erhard Prettauer, Executive Vice President David Williams, Executive Vice President for Markets and Products Scott Markovich, Executive Vice President for Strategy and Business Sanjoy Mizunuri, CFO Larry Smart, and COO Fred Schultz. When you try to access those pages themselves, you get an error that say the requested URL was not found on this server. So, yeah, they're nuking their own pages. All right. I try to get information on this executive.
Bing, 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 boom. It's gone.
It's gone. Now, another nonprofit health plan, Medica, did the same. Medica's executive leadership page now redirects to its homepage, and its foundation leadership staff page now returns an error saying, oops, that page doesn't exist.
Whoopsie.
It's gone. But is it really a whoopsie? Elevance Health also took down its leadership page, replacing it with a message that says, sorry, that page is no longer here. Here's the thing. We don't even know what the motive of the shooter was. Yes, we can speculate. I've done plenty of it. Okay. I personally think that the shooter either dealt with UHG personally or had a family member hurt or killed by their profit-making policies. But I don't know for sure. I don't know. I don't know if we'll ever know. But the fact that insurance executives are spooked makes me think that might be the case, that it's a burned customer. Or maybe they're starting to realize that their decisions for profit are having lasting negative outcomes and that people are angry about it. And I'm not surprised. Okay. Now, take this thread on Reddit from r/medicine. It's actually one of the internet's top medical communities. These are doctors, okay, who spend an inordinate amount of time arguing with insurance companies, okay? If you ever wondered why your doctor only sees you for like 5 minutes, it's because that doctor is spending the majority of their day, of their time, arguing on the phone with insurance companies that want to deny every single test or procedure or medication that they can. They're out there saying, no, I have a patient here that needs this procedure or that needs this test done. Yeah, but do they really? I mean, I don't know. It sounds kind of expensive for us. I mean, if you really want, to do that procedure, it's going to be without us covering it. So understand that that's one of the problems, okay? Now, the top comment on that thread, which received hundreds of supporting upvotes from other users, went after UHC's notorious track record of denying claims. And it was basically addressed to an unnamed applicant, saying, following a careful review of the claims submitted for emergency services on December 4th, 2024, it informs them that they are being rejected for coverage because you failed to obtain your prior authorization before seeking care for the gunshot wound to your chest. Wow. If you'd like to appeal the fatal gunshot, please call 1-800-555-1234 with the case number 123456789P to initiate a peer-to-peer within 48 hours of the fatal gunshot. That thread ended up being nuked by the moderators, because it was so popular. But it didn't stop other threads from popping up. Now, one doctor whose identity the Daily Beast had confirmed expressed sympathy for Thompson's family and said the killer should be charged with murder, but then said this, quote, I cannot even guess how many person years UHC has taken from patients and their families through denials. It has to be on the order of millions. His death won't make that better, but it's hard for me to sympathize when so many people have suffered because of this company. Or his company. Yeah. There's another confirmed doctor who wrote this. What has bothered me the most is people that put fiduciary responsibility, e.g. the profits, okay, because understand that in our current corporate structure, fiduciary responsibility to shareholders, i.e. to be able to give, to generate profits and then give that money to the shareholders. That is what a CEO, that's their primary function, okay? So that's the corporate structure for you right now. Now, that doctor writes that, what bothers him is putting that above human lives. None more so than this company as run by him. Again, Thompson, very notorious for running these these systems at UHC in such a way as to deny about a third of all claims. Okay, and I talked about the AI model used in their UHC Medicare Advantage plans. I mean, that had a 90% rate of error rate. Okay, and their error rate. I don't think it was an accident. I think that the AI program was running as intended to deny as many people legitimate claims as possible. That's the problem. Okay. Now he ends by saying, quote, when others' human lives are deemed worthless, it's not surprising to have others view your life of no value as well. Yeah. And look, here's the thing though, right? I mentioned the corporate structure. That's part of the problem. The other part of the problem is our healthcare system to begin with, okay? The United States is the only modern country to not have universal healthcare. Yeah, everybody else seems to have figured it out, except for us. Except that we have figured it out. The problem is that you have people in charge and you have people that are bankrolled by these very companies that don't want to go to a better system because it's not better for them. It's better for us, better for average people, better for patients, better for taxpayers, okay, better for the government, but not so good for the CEOs and the shareholders, okay? And this is why we continue to be the only modern nation where people go bankrupt due to medical issues. Look, we should have universal health care, but our political parties are too corrupt by donations from these companies to vote in favor of it. So until that happens, there's going to be more deaths as a result of denials and more people that can't afford healthcare. The irony here is obviously universal healthcare would save more lives, including CEO lives, right? But that's not going to happen until we get money out of politics and get a truly universal system. Until then, unfortunately, these people, these executives, they're going to continue to hide. They're going to spend money on more security for themselves, okay, as more average people continue to suffer in order to feed these companies greed. They're going in the wrong direction. The right direction is Medicare for all. Thank you for watching. If you enjoyed this video, please like, share, subscribe, hit the bell icon in order to get notified whenever a new video is released. And if you want to support independent, progressive media through this difficult time where it seems like everybody is shutting down, you can become a member on our YouTube page, you can become a subscriber on Facebook, or you can go to my Patreon. It's patreon.com/Jeff Waldorf. Thank you.